Well, I hope you're satisfied.
I am.
I hope you're satisfied. You don't understand what this is like.
No, I know it's
I am
hard.
absolutely scared to death.
I know. It's going to be okay, though.
Everybody has said our lives are never going to be the same.
I know, but it'll be better.
And I hope you aren't even planning on going to another ball game this year.
No, your mother's coming in to help us out.
No, Mother came to live with me.
I know, and she's going to help both of us.
You're going to help me, too.
No,
this is your baby, too, to the best of my knowledge.
I know.
It's your baby,
what?
too.
To the best of your knowledge?
Yeah, that's what I said.
What do you mean? This is just a great time for you to be telling me this morning. I really appreciate it.
Just what I said.
But we'll focus on the baby and
Hey, how are you?
How are you doing?
I'm doing good.
I have been looking
Dan
forward
Hurst.
to seeing
You
you.
hug
to
real
meet
quick.
you.
All right, Mr. Hurst, how are you? I'm Dr.
I'm
Sessions.
fine. How are you
How
doing?
have you been?
I have been really, really good.
I have been looking forward to seeing you.
You got here a little sooner than I thought you
Well, I wanted to see you.
would. You look so radiant. She's one of my
thank
most
you.
special patients.
Really?
I
You
can't.
can stop it. That's great.
I love having you here. Are you hurting? Are you doing
no,
okay?
I'm fine right now. Thank you.
Okay, well, it looks like everything's going okay, and I'll come back and see you soon, okay?
Don't be gone long.
All right,
okay?
bye-bye.
All right.
Nice meeting you.
Okay.
Nice to meet you,
Bye-bye.
too.
Bye.
Nice to meet you, too. Don't be gone.
He is precious. He is
Isn't
just
he
precious.
I'm sure.
I'm telling
sure.
you.
You think every man that comes within 10 feet is precious.
Compared to you, yes.
Well, and whatever.
Oh,
Listen,
please,
we'll
just
worry
stop.
about. Okay,
I'm
fine.
hurting right now.
Fine.
I'm
Okay,
having
I'm
a baby.
sorry.
Would you
We'll
please?
we'll worry about it later. Okay.
Just
I'm
stop
sorry.
it.
Okay.
Stop! I don't want to hear any more of your voice.
What?
No.
Okay. It's okay. It's okay. I'm sorry. It's okay.
All right, now, the first complication of pregnancy we're going to talk about is miscarriage. This is also called a spontaneous abortion, and spotting is common during pregnancy, but the combination of bleeding and cramping is more indicative of a miscarriage. Signs and symptoms: bleeding, cramping, backache. We're going to measure the HCG levels. We worry when the HCG levels start to drop, okay? As long as those HCG levels are still up there, then everything's okay. Treatment: bed rest, abstinence from sex, may have to be sedated, but if miscarriage is imminent, the patient may need an IV. They might need blood. It just depends on how much blood has been lost. And then some people need a dilatation and curettage so they can go in and remove any remaining products of conception. Okay? Now, hydatidiform mole is also called a molar pregnancy. This is a benign neoplasm that can turn malignant. We have grape-like clusters of vesicles, and it may or may not have a fetus involved. For our purposes, there is no fetus involved, okay? Now, there are times when there is a twin pregnancy where you can have one normal baby, and then instead of a baby, we have a hydatidiform mole. We're not going to get into all that. Now, how does this pregnancy start? Just like normal, just like any other pregnancy. But what happens is, and you can see by signs and symptoms, the uterus enlarges too fast, absence of fetal heart tones, and bleeding. And sometimes in the blood, you can actually see the little clusters of vesicles. Now, this is confirmed with an ultrasound. With a small mole, they're going to do a D&C. They're going to have to empty the uterus. Do not get pregnant. Follow-up is very important. They can get pregnant, just not right now. Not during the follow-up time. You'll see why in just a second. If it becomes malignant, it is called choriocarcinoma. Now, they will do chest x-rays to determine metastasis, and they're going to measure HCGs weekly until normal, and this is going to be rechecked every 2 to 4 weeks, then every 1 to 2 months for 6 months to a year. All right, now, during the follow-up time, you do not want them to become pregnant, because when you become pregnant, your HCG can go up, but if this turns malignant or metastasizes, that can make your HCG go up. So see, we don't want to confuse things, all right? Now, the next thing we're going to talk about is ectopic pregnancy. This is a gestation outside of the uterus. And where does it usually occur? The fallopian tube. Fallopian tube. And this is confirmed with an ultrasound. Confirmed with an ultrasound. The first sign will be pain. The first sign is pain. Now, signs and symptoms. The patient will exhibit the usual signs and symptoms of pregnancy, but then they start having pain. They may be spotting or they may be bleeding into the peritoneum, all right? So the blood may come out where you can see it, or they can bleed backwards into the peritoneum. Now, if a patient has had one ectopic pregnancy, she is at risk for another. Treatment. Methotrexate is going to be given to mom to stop the growth of the embryo to save the tube, if possible. Okay? If methotrexate does not work, a laparoscopy may be done. A small incision will be made into the tube and the embryo will be removed. The entire tube may have to be removed. Now, a laparotomy, all right, is done if the tube has ruptured or if we have an advanced ectopic pregnancy. Now, if the tube does rupture, your patient could hemorrhage and may need a blood transfusion. What do you think we all named the baby?
I don't know what you want to name it.
I don't know. I'm getting excited
am
now.
too.
This
We got
is
some
fun.
books at home.
I know, but
We'll-
we need to be deciding.
We'll get somebody to bring the books.
You know
to
what?
us.
What about the name Dr. Patrick Sessions? You know, that's my doctor.
Marlene,
We can name
we
him
are
Patrick.
not naming him Patrick.
Pat?
You just told no.
Patrick?
Nothing with a P. Okay, you just told me some
I
news
just
I
think-
was not
I
expecting.
think that is
so
a pretty
I'm
name,
trying
though,
here.
if it
You
were a
really
boy.
need to work with
I
me.
think that would be
I'm
a
trying
pretty
to be
name.
as consoling as I
Okay.
can.
Wait a minute. Shh. Act normal.
okay.
Somebody's coming in.
Hi, my name is Autumn, and I'm the graduate nurse, and I'm going
A
to be
graduate nurse?
taking
What does
care
that
of
mean?
you today.
We've never heard of a
Marlene.
graduate nurse.
Are you a registered nurse?
I will be.
Um,
will be.
What does your tag,
Well,
Marlene? That says GN.
What
I
does
thought
that-
it was supposed
well,
to
what
say
that
They
means-
say
RN.
on TV you're supposed to watch the tags when they come in.
You are, and they're supposed to have their pictures on them too. She didn't even have a picture. Are you?
You're scaring
well,
me.
I'm
Yes.
sorry. I have graduated from nursing school, but I haven't taken the boards
You
yet.
haven't taken NCLEX yet?
Not yet, but I haven't scheduled.
Marlene, wait,
I haven't
What about that
scheduled.
other class?
And
have
don't-
you taken Hearst Review
well, I
yet?
had that scheduled too.
She has not. Well,
Now-
you have got
now-
to take Hearst
Now,
Review.
don't worry, okay?
You've got to-
I can,
Marlene, she has not even
I'm
taken
certified
Hearst
to take
Review.
care of you. I can take care
She
of
has
you.
not
now,
taken Hearst
I've
Review.
got to
Look, we
listen.
really need.
What is a
who is your
preceptor?
preceptor?
Now her name is Miss Thompson, and right now she I think she's at the nurse's
You
station.
think?
Well, I
Or
think
is
we
she-
might
is
wanna
she
talk to
here?
her.
Is
She's
she here?
I
Yes.
think we might want to talk to her.
Yes. Let's meet her. Is she a registered nurse?
She is.
Okay, I
She
think we
is.
would be more comfortable, don't you think?
I would just
Okay.
meet
Oh,
her.
okay, I'll go get.
This
I'm
is
sure
our
you're-
first baby.
I'm sure you're fine.
I'm sure you're good and all, but I mean, this is our first child. We're really a little nervous. Okay.
Okay, I'll go get Miss Thompson.
Please.
Please do, Marlene. She's
My
not
gosh.
even a registered nurse.
I cannot
Are we
believe
gonna-
you let her
wait,
in the
why-
room.
Why didn't we go to the
Why
other
did you let
hospital?
her in the
Why
room?
didn't we go? Why didn't we go to the
Well,
other
we're going to meet Miss
hospital?
Thompson and we'll see.
Okay.
The next thing we have, placenta previa. It's the most common cause of bleeding in the later months, usually the 7th, and the placenta has implanted wrong. Underline that sentence. An ultrasound will be done to confirm placental location. Now, the placenta begins to prematurely separate when the cervix begins to dilate and efface, and the baby doesn't get oxygen. Now, normally, the placenta should be attached where in the uterus? Up high in the uterus, okay? Now, as you know, with placenta previa, that placenta may be sitting on the side of the uterus. It may be down halfway covering the cervix, or it can be all the way down, completely covering the cervix. Well, whether the placenta is here, or here, the key is this. What's coming out first? Placenta, and that's not going to be a normal delivery, is it? Right. Signs and symptoms. Underline the word painless. Bleeding in the second half of pregnancy, and they may be spotting or it may be profuse bleeding. Treatment. With a complete previa, you usually have to have hospitalization from as early as 32 weeks until birth to prevent blood loss and fetal hypoxia if our patient goes into labor. If there's not much bleeding, bed rest and watch. Rule out other sources of bleeding. We're going to need to do pad counts. We're going to need to monitor the baby very closely. And we better be monitoring for contractions, because if she starts having contractions, we've got to hurry up and call the doctor, because this is not going to be a normal delivery. We've already said the placenta is coming out first. The delivery method of choice, a C-section. And remember, with placenta previa, do not perform any pelvic exam. You could puncture into the placenta, but also you can precipitate a delivery too. Abruptio placenta. Now, is the placenta implanted normally? Yes. Maybe partial or complete. What happens is it separates prematurely and we get bleeding, and that bleeding may be external or concealed. If it's concealed, that means they're probably bleeding into the uterus. It's seen in the last half of pregnancy, and they're going to do an ultrasound to confirm the diagnosis. Causes: MVAs, domestic violence, rapid decompression of the uterus when the membranes rupture, and also associated with cocaine use and PIH. Cocaine and PIH, pregnancy-induced hypertension. Pregnancy-induced hypertension. Signs and symptoms: pain, difficult to palpate the fetus because the uterus is filling up with blood, board-like abdomen. Anytime I see board-like abdomen, I think bleeding. Method of delivery: C-section. Now, here's just a rule, y'all. Do not do vaginal exams in the presence of unexplained vaginal bleeding. That is a rule that you follow. Well, how much time are you going to get to take off from work?
At least 2 weeks. I'm trying to get more than that, Marlene. I'm doing the best I can.
I'm going to be barely walking in 2 weeks.
We have got to have some income. We are having
I've got
a baby.
to have some help.
Well, that's why you called your mother.
I know,
it's
but
not
Mama,
my fault that
look,
you asked her to come.
I cannot stay
you
with
know
Mama
I don't
for
like
6
her anyway.
weeks.
That's why I'm going to go
6
on to
weeks
work.
by
Well,
myself.
that's why she's there.
Please, here's...
Well,
Hi, my name's Carol. I'm going to be your nurse.
hi, Carol.
Nice to meet you.
Nice to meet you,
Nice
Mr.
to
Hurst.
meet
Nice
Please,
to
I'm
meet you.
hurting.
Hi
This is
there.
my wife, Marlene.
Nice to meet you.
This is our first pregnancy. I'm sure you can tell.
Marlene, my name's Carol. I know you had some concerns about Autumn being
Yes,
a
we
graduate
have
nurse.
concerns because she doesn't look like a nurse to me.
Are you a registered nurse?
I'm a registered nurse. I have
her
more than
name's on her
21
badge.
years
Yes, and she's got a
experience.
picture too. They're
Yeah.
supposed to have
And
a
I'll be
picture.
right with Autumn doing everything she does, okay?
Are you sure?
I
you
promise
sure?
you that, okay? I promise you.
Well, she scared me.
Well,
she did. Is
she's
that-
going to be working directly
Yeah.
with me, okay? All right?
Is that your? Could you come just a little? Is that
Uh-huh.
your picture?
It is.
Okay. Okay.
Yeah.
I'm just
Yeah.
checking. That's her.
And I'll be right with you, okay? We want this to be a wonderful experience and you to be glad that you came to our hospital, okay?
Well, I'll be
We
glad
are.
if
We'll- I
everything
think
works
we'll
out
be
okay.
fine.
Okay.
I think
All
we'll
right.
be fine.
Well,
Thank you.
Now, she has a few questions she needs to ask you. Is that okay? Do you feel up to answering just a few
I'll
questions?
try.
Sure.
Well,
Okay.
That'll be fine.
I'll
Just
try
ask
to
us
answer some
more
questions.
Well, I'll help I'll help as much as
I'll
I
try.
can.
And if you need
But I
anything at
cannot
all, just
promise
let me
anything.
know, okay?
Okay.
I'll be right out
Thank
here,
you
okay?
so
Nice to
much.
meet
Nice
you.
to meet you too.
And we're glad you chose us.
Thank
okay?
you.
Thank you
Okay.
so much.
Well, she's sweet.
Will you talk about Dr. Sessions?
Hi, I see you've met Miss Thompson.
Yes, we did. She is very nice. Very nice.
And she told you I was going to be asking some questions.
Yes.
Well, yeah.
Okay.
But can
we-
you make it fast because I am not
Well,
feeling
it's-
We
good.
talked to the pre-admit nurse downstairs.
I've answered everything I know to answer
I mean,
already.
Everything should be on file. Do you have her chart out there?
Yep. Can you just get the file?
Well, I have to add, I have to
I'm
fill out
feeling sick.
my paperwork. So it's just a few questions.
Demanding.
I know.
It's just a few questions. Now, are you allergic to anything?
I've already told him I was allergic to penicillin.
I'm so tired of hearing that question. And go ahead and put down sulfa. Everybody's allergic to sulfa.
Are you allergic to sulfa?
But he said to put it down.
Just put it down, please, so we'll avoid it later.
And going back to the penicillin, what does that do if you take penicillin? What happens?
Well, duh, it gives me a rash.
Okay.
Can you believe this?
And I'm sorry, I'm just
That-
trying to
that's okay,
fill
just-
out my
We're
paperwork
just
here.
real anxious here.
Oh, my goodness.
What about the sulfa?
Oh, God.
What does
But-
that?
Diarrhea.
Oh, gosh, I can't
Everybody
take it.
gets
Oh,
diarrhea
my
when they get.
gosh,
Please go
Daddy,
get somebody that knows what they're doing. Please,
right.
please. She is in
Daddy.
pain. Where's the call? They did not even put the call light by the bed, Marlene. They didn't even put the call light. I don't know, sweetie. We'll figure it out. I'll run out and get some help. Just hold on. Hold on a minute. Hold on.
Oh, please.
Just
I'm better. Incompetent cervix is next. This is when the cervix dilates prematurely, and this usually occurs in the 4th month. The patient will have a history of repeated, painless, second trimester miscarriages. Now notice I said second trimester because most people, if they have a miscarriage, have it during the first trimester. This patient's getting pregnant easily and they're making it through the first trimester okay, but when they get to the second trimester, they have a miscarriage. Why is that? Because in the second trimester is when the baby's getting enough weight, which is pressing down on the cervix, causing it to prematurely dilate. Okay? In the first trimester, the baby doesn't have much weight. All right, now treatment. Purse string suture at 14 to 18 weeks to reinforce the cervix, okay? Now some people call that a cerclage. C-E-R-C-L-A-G-E, cerclage. And they may have a C-section to preserve the suture, but some doctors clip the suture so the patient can deliver vaginally. It just depends on the doctor. And there's an 80 to 90% chance of carrying the baby to term. Oh, me. Starting to feel sick. Goodness gracious.
Can I help you?
Yes, I need a nurse. I'm getting sick at my stomach.
Okay, we'll be right there, okay?
Okay.
Yes, ma'am, Miss Hurst, can I do something for you?
I'm getting sick at my stomach.
That sounds like hyperemesis gravidarum.